also looking very closely in the advancement of AI in healthcare. Could you share with us a little bit more on the potential of AI in healthcare and its direct application, and how would you use that, in your business? Yeah.
Yeah, okay, let me actually start with this. Thank you. I think the crunch in the healthcare workforce, I think most of the time is because in healthcare, right, you need to set the priority in seeing a patient. Sometimes this priority also might have some argument on who first will get treatment, you see. So this one create a lot of this challenge, for the front line of this workforce to manage the expectation. Yeah, at the same time also, we do want to overlook any severe case that potentially happen to the patients, especially at the emergency department. So most of the hospitals today, if let's say you see people are piling up at the emergency department, and emergency department, you have a challenge to really fast to screening through each of the patients, right? So because you do not know, you do not know who is more severe on this case, and some patients rush to the emergency department because they have a panic attack, right? They just feel panic and they just want to find it out more, right? So these are patients that I think we can first handle by using the AI, like example like AI chatbot, okay, to help them to determine this triage, as a triage stage of the services, that determine the severity, whether they need to visit immediately or they can do some other alternative at home. Yeah, so this is one of the things that the AI really can help, because if let's say that you observe today landscape, none of the hospital dare to give this responsive service for the question and answering to the patient. And one of the challenges because of also the compliance purpose, that we want to really safely determine what is the thing that we can answer, what is the thing that we cannot answer at this stage. So with the AI and also the maturity of the LLM, like the open AI ChatGPT, we really can actually personalize this experience that can be really helpful to reduce the queue in the emergency department. Yeah. So to me, that is a real help, in the triage service, and also the after treatment follow-up. So after treatment follow-up, very rare patients receive very good care, at home. Yeah. So I think that responsiveness to follow up with the patient, whether they follow the prescribed treatment plan, to them at home, or whether they still continue after a week, that before they come to the next appointment, is very important to make sure that everything is on track. So over here, AI also can help in the auto reminder, and also personalized to the experience of this journey, to their recovery of the treatment plan that prescribed by the doctor. Yeah, for the next 3 months or next 6 months. Yeah, so that we can keep in touch with the patients, that they are not left out, they are motivated and they are continually supported, by the provider. Yeah, thank you.
So you touch upon long-term support and care from the provider, and it can be done remotely, and also for the patient to track their own performance of their health, and knowing when is the right time to then go see a doctor or go to the hospital, and don't visit it unless right? Yeah. Okay, Fiona, what's your point of view on this?
So from our case, we have 3 steps of integration of the AI. So firstly, we trained an algorithm for a early stage detection, which is like we use our selfie cam on the mobile phone, and we take picture of our hairline or our facial skin or body skin that runs a rough analysis of what does the syndrome might look like. And then besides that, the second step is actually using this triple scope, which is something the dermatologist would use in their department at the same time, which is like a microscopic image of our skin. So it shows like 100 times magnified images of the skin for running better analysis for different parameters. So this part we have been working with medical institutions both in mainland China and Singapore to train a medical image of more than 22,000 like annotated skin and scalp. So we can provide like 16 different parameters quantified out for different syndrome detection and diagnosis. And then the third step for us is actually after having this result, this report of like all these quantified details, we need to provide you with like product recommendation based on like biochemical components in the cosmetics or the pharmaceutical products, or we provide you with like lifestyle to change, supplements to take, like these kind of advice. So this is actually a new model we have been training that is so the previous two is like semi-inspection AI model, and then the last one would be even more frontier, which is kind of like an AGI healthcare advisor.